Hi, welcome to Body Beautiful. I'm Janelle Marie. This is the show where we talk with local professionals about various medical procedures and devices. With us today, we have our favorite plastic surgeon, Dr. Joseph Mealy. We're actually coming to you from Dr. Mealy's offices right here in Walnut Creek. We're going to be talking about a lot of procedures today. We've got tummy tucks, male breast reduction, female breast reduction, and finally, we'll talk about arm lifts. And remember, any advice we give you today, please consult your physician first. All right, Dr. Mealy, hi, and welcome to the show.
Hi, Janelle. So nice to be here.
So nice to have you here. So let's talk about tummy tucks. Of course, we've got breast augmentation, always number one on the list, but I'm telling you, tummy tucks are very popular right now. Am I right about that?
You are right. They're always in the top 5.
They are for sure. And why is that?
Well, I think part of the reason is we have babies, and
That's
the
true.
babies tend to stretch out the bellies as well as cause changes in the breast. So those are two areas that we consider areas of beauty, and as a plastic surgeon, it's an area I pay a lot of attention to.
And I think it's very overwhelming after a woman has a baby. She believes she's never going to get her body back. And I think this is wonderful that we can talk about this and there's something you can do.
There is something I can do.
All right, so let's go to the pictures, shall we?
Sure.
Because we can see these pictures on your website, the before and afters.
Yes.
But let's talk about picture number 1.
Sure. Well, typically we talk about several different patients and go through the results, but I just wanted to spend time and kind of drill down on the specific points that we're going after with tummy tucks.
Okay,
So
good.
this woman, she has had babies. The belly's stretched out. We
Right.
see a little bit of fullness at the hips, a little widening at the waist, some fullness down below the underwear. The skin's a little loose. And then she's had previous surgery. She had some laparoscopic surgery through the belly button and also a C-section. You can kind of see the scar down below.
Yep.
Wasn't really happy with her current scars and really didn't like the loose skin.
And so in picture number 2, that's how you did the procedure. Talk about that.
So this is what I'm doing at the deepest layer. This is getting
Wow.
the muscle together. So that
Oh,
wide
okay.
band in the middle is
Yep.
the separation, or we call it a diastasis, between the rectus muscles. The outer lines show the outer aspect of the rectus muscle. Normally when we're born, they overlap by about a centimeter, about a finger's breadth in the middle. So when I'm doing a tummy tuck, that's what I'm trying to restore. So
Gotcha.
I'm pulling those muscles back together. We're not cutting them,
Wow.
we're not injuring them. We're just tightening up the case that they're in. And you can see the outer edge of the muscle gets brought in also, which also improves the shape of the waist.
You're kind of making a corset right there.
Well, it's the foundation. So if I can make a flat foundation, much better to have that, then we can have a flat belly.
Let's go to picture number 3. What's happening there?
So number 3, we've got the area that we're removing fat from. So the lower part of the abdomen is where we tend to store the most fat.
Right.
That is removed because we're essentially removing all of that skin and all the fat underneath it. On the outer edges where we're not removing skin, I can still remove fat by using liposuction. So often I'll do some liposuction at the edges if it's necessary, or if there's some fullness behind like the love handles, we want to reduce that. I can continue that liposuction around to the back and make the whole trunk match.
And you were talking about putting the muscles back together. Now, that sounds like quite a recovery period. Can we talk about the recovery period for the tummy tuck?
Well, it's sore because we're working on that muscle layer. It's the same like repairing a hernia. It's
Right.
a tough layer. People have told me it's similar to having a C-section if they've had a C-section before. First couple days may need a little help getting up, and then after that can get up on your own, move around. Driving usually about a week. Heavy lifting, because we repaired the muscle like a hernia, is
Right.
about 6 weeks.
And it's under general anesthesia?
Absolutely.
And also, after the muscles are put back together, can we do this with other procedures? Because we talk about mommy makeovers,
Sure.
and if you've had your babies and maybe you want something else fixed, you can do multiple procedures?
Yeah, I mean, most common would be to do something with the breasts because they also change.
Right.
If they get bigger, we can do reductions. If they're smaller or loose, we can do breast augmentation or lifts.
That's wonderful. And you know, a lot of women have stretch marks problems.
Yes.
Can we get rid of those when we do these procedures, or are they always with us?
Kind of. The stretch
Yeah.
marks that are below the belly button leave with the skin. But stretch
Gotcha.
marks that are above, they
Gotcha.
tend to still be there.
Hey, you had a baby. That's, you know,
Yes.
that is a wonderful thing.
There is some evidence.
Final picture.
So the last picture is really the skin excision. So that excision is sort of a lens shape. It tapers at the edges, and it lets me remove all of the skin from just above the belly button to, in this case, below the C-section scar. So that C-section scar is removed.
You know what, let's talk about scars, because
Sure.
a lot of women don't have a procedure because maybe they're afraid of the scarring. What are the scars like?
So the scar, it tends to be low. We keep it below the belt line so that you know we can wear normal clothing and really not see the scar. But it is a scar. It is the price to pay for a tummy tuck.
And then what about mini tummy tucks? Because I know you sew the muscles together. What if you don't need that?
If you don't need that, in fact, if everything looks great above the belly button, that would make you a better candidate for the mini tummy tuck, because in that case, we're removing about half the skin
Wow.
between the belly button and that lower part of the waist. And then also, I can tighten the muscle in that lower part if we need to. Often it's combined with liposuction, though, in order to get the rest of the abdomen looking right.
And there's always the myth out there that you get a new belly button What's that?
Not a new belly button. It's still
Okay.
your belly button. In fact, if you look at the last picture,
Yeah.
there's 2 arrows in that picture that show
Right.
little moles on the skin. And as we pull that skin down, all that skin was above the belly button.
Yeah.
You can see that lower arrow gets moved down almost to the
yeah.
waist, and the upper arrow actually comes down too. So that skin stretches. That's how we tighten that skin above.
Gotcha.
With a mini tummy tuck, we're not pulling that hard, so we can't really tighten the skin above. In fact, we don't let go of the belly button. We leave the belly button attached, so it's impossible to pull that skin in a mini tummy tuck.
It just gets a new zip code.
Exactly. It gets new neighbors.
And then all the scarring and all the discoloration of the belly button is gone.
Right, because she had this sort of stellate scar from previous surgery. What I've done is just save the circle in the middle, and then the skin around it's all new, so we can make that look right.
All right, that sounds good. If you want more information on the tummy tuck or any procedure, call the doctor's office at 925-943-6353. You can go to the websites and see all the before and after pictures, drmealy.com, sanfranciscobreast.com. Keep it right here on Body Beautiful. We will be back, and I believe we are talking about gynecomastia next. Keep it right here on Body Beautiful.
The information and advice given on this program is for general informational purposes only. For medical advice on specific treatments, medical professionals should be consulted. You should not initiate a course of treatment without consulting a qualified doctor.